All right, let's dive deep today as we unpack what's going on with the Centers for Medicare and Medicaid Services, or CMS as most folks know them. We're going behind the scenes today in a really unique way. We're talking about an agency that's a huge part of American healthcare.
Yet today we're looking at something called a Sources Sought Notice. It's a document that basically lays out CMS's priorities, and it shows where they're looking for help to take on some big challenges.
So it's like we're getting a sneak peek at their strategy. Imagine you're in a meeting at CMS headquarters. This document is like we're seeing their whiteboard, full of ideas and concerns. I mean, we already know CMS oversees Medicare, Medicaid, CHIP, and the marketplace, right?
Right, that's over 130 million people. But this document goes beyond just the day-to-day. It shows they're really concerned about making sure there's a smooth transition of power with the new Trump-Vance administration.
Oh, interesting. So it's not just about keeping things running. They're also thinking about how healthcare policy might change.
Exactly. The document even mentions the Office of the Administrator and how it will analyze all the new administration's healthcare initiatives. They want to make sure things continue for all those beneficiaries, but also they got to adapt to any new policies. It's a tough balance, for sure.
Yeah, that makes me think about how massive CMS is. How do they even start to make something that big run better?
Well, that's a key thing this document shows us. They're actively looking for ways to be more efficient and more effective in pretty much every area. Things like their structure, their workforce, programs, how they manage performance and data, everything.
So they're basically shopping around for the best people to help them. Is that through this sources sought notice?
Yeah, and this Enterprise Operations Blanket Purchase Agreement, or a BPA.
Okay, a BPA.
It's like a pre-approved list of experts they can call on without having to go through a long process every time.
So this document helps them decide who those experts should be. So it's not like a job posting, really.
No, it's more like, tell us what you can do. And the really cool part is what they're asking for. This BPA has 5 categories of tasks. Each one shows what CMS is focused on,
Okay, I like it.
like performance and data management, then portfolio and project management, and change management, strategy development and implementation, and finally, mission essential planning and response.
All right, let's break this down a little. Performance and data management. That sounds pretty simple, right? But
Yeah.
I want to know if they're doing a good job and use data to improve.
It's more than that. Think about how healthcare is moving towards value-based care. CMS has millions of beneficiaries. If they can track outcomes and see how well treatments are working, it could really change things.
Wow, I didn't think about it like that. So they're not just looking at numbers, they're using data to try to make healthcare better and more efficient.
Exactly. And that's a huge job, especially for a big organization like CMS.
Yeah, for sure. It sounds like they really want to make good decisions with all that data. What about portfolio and project management? Why is that so important?
Think of CMS like a giant company. There are tons of projects happening all the time. They need help to manage all of that. Scheduling, budgets, making sure things are on time and within budget. It's a lot to handle.
It makes my to-do list look easy. So they're
Yeah.
looking for people who can bring some order to all that.
Right. And then there's change management.
Hmm.
Imagine trying to change anything in an agency as big as CMS.
I'm already stressed just thinking about it. It must be like trying to turn a giant ship around.
Yeah, and they're dealing with people's health care. So any change has to be done carefully and effectively.
They can't afford to mess things up. What about strategy development and implementation?
Mm.
So they're bringing in the big thinkers.
Yeah, this is about coming up with solutions to complicated problems and making sure new policies actually work in practice. They need people who can think strategically on a big scale.
So not just experts in one area, but people who can see how everything at CMS works together.
Exactly. And then the last one is mission essential planning and response. This covers things like getting ready for emergencies, like how they'd respond to a big health crisis or a natural disaster.
Especially with everything going on in the world lately. I can see why that would be so important to CMS. It's about making sure healthcare systems can handle anything, right?
Absolutely. They even mention planning for different scenarios and creating frameworks to reduce risks. They're thinking ahead, trying to be ready for problems.
So it's not just about fixing things when they break. It's about preventing them from breaking in the first place.
Right.
Okay, so just from these 5 categories, we can see CMS is looking for a lot of different expertise.
Yeah, it's not just about managing projects or analyzing data. It's about understanding how healthcare works as a whole and thinking strategically about how to solve some really tough problems.
I'm already seeing how this sources sought notice tells us a lot. It's like a window into how CMS is getting ready for the future. But we're just getting started, right?
Yeah, there's more. The document gets into the specific skills and experience they're looking for.
Oh, wow. Well, I can't wait to hear more about those details. We'll be right back after a quick break.
All right, we're back, ready to dig into the specifics. What exactly is CMS looking for in these partners? We talked about those big categories like data management and strategy, but I'm curious about the details.
The details are really interesting. For example, they want people with experience with tight program schedules and cost containment and cost-saving methods.
Okay, so they're under pressure to get results quickly and save money. Makes sense, their programs are huge, but what does that actually mean for the partners?
It means they need to be able to start working right away, meet deadlines, stay within budget, and they need to have a history of finding ways to save money. And remember, this is healthcare. It's really important.
Right, it's not just about saving money. It's about making sure people still get good care. Millions of people rely on these programs. That's right. And they also know they need the right people. The document talks about meeting and tracking performance and hiring and keeping good employees.
So talent matters just as much as systems and processes.
Exactly. They need partners who can find and keep talented people, especially since it's hard to find qualified people in healthcare right now.
Makes you wonder if they're also trying to fix some of their own problems. Maybe they've had trouble finding the right people in the past.
That's a good point. Maybe they're using this to get outside help, to fill in some gaps.
There's something else I noticed. They want partners who are good at spotting trends that could affect CMS, and they specifically say it's 67 million beneficiaries.
That's really important. I mean, CMS is trying to be proactive, not just fixing problems today, but thinking about the future.
So, like seeing what's coming before it happens.
Exactly. New technologies, changes in demographics, healthcare needs, they need partners who can help them stay ahead of the game.
And be able to change quickly when they need to. Does this connect back to the new administration? Could a new administration mean new challenges and new priorities?
It could. Having partners who can see those changes coming would be really valuable.
For sure. They also mention risk mitigation and conducting reviews of inquiries.
Well, risk mitigation is pretty self-explanatory. When you're dealing with healthcare for so many people, there's a lot of risk.
Yeah, data breaches, natural disasters, policy changes, anything could have a big impact.
Exactly. And then conducting reviews of inquiries. That shows they want to be transparent and accountable. They want to make sure they're addressing concerns and answering questions.
From people who use their programs and other stakeholders.
Right.
So they're trying to be more responsive and accountable. But what about this emphasis on enterprise level? What does that even mean?
It means they don't just want experts in one specific thing. They need partners who can operate at a higher level. Someone who understands how all the parts of CMS work together.
So seeing the big picture and how everything connects.
Yeah, they need partners who can think strategically and understand that a decision in one area might affect other areas.
That's asking a lot. Will they even be able to find partners who can do all of that?
It will be tough, but it shows how ambitious CMS is. They're not satisfied with the way things are. They want to really change how healthcare works.
This is giving us a really interesting look at how CMS is approaching the future. And we're just scratching the surface.
Yeah, we are. This document tells us a lot about what they're worried about and what they're hoping to achieve.
It's way more than just a boring government document.
Right. It gives us real insight into CMS's priorities.
And how they're planning for the future. We'll be back in a minute to talk about what all this means for American healthcare. We've been digging into this sources sought notice from CMS. But what does it all mean? Like, for the average person, someone who uses Medicare, Medicaid, or the marketplace.
Well, I think it shows that CMS knows they need to change. They're looking for help to evolve and adapt.
That's good, but a lot of people don't trust the government with healthcare.
I get it. Healthcare is really personal. People want to know that someone's taking their needs seriously. But this document shows they're trying to be more data-driven, more strategic and responsive.
So they're not just waiting for problems to happen.
Right. They're talking about measuring performance, reducing risks, looking for trends. It seems like they're trying to be more proactive.
We talked about the new administration. Does this mean they're worried about changes coming?
It's possible. But healthcare is always changing, no matter who's in charge. They need to be ready for anything.
And they're hoping that working with partners will help them.
Looks like it. They want experts who can bring new ideas and solutions.
What do you think will be the toughest challenges for CMS in the next few years?
The cost of healthcare is a big one. They need to find ways to keep costs down. but without making quality worse or making it harder for people to get care.
Yeah, that's a tough balance. What else?
The growing number of older people. As more baby boomers retire, more people will need Medicare and Medicaid.
So they have to figure out how to help more people with probably more complicated needs, but with the same amount of resources.
Exactly. And then there's all the new technology, like telehealth, AI, personalized medicine. It's all changing how healthcare works.
So CMS has to keep up with that
Mhm.
and make sure these new technologies are safe and actually help people.
Yeah. And they have to do all of this while dealing with politics and making sure they're meeting the needs of everyone.
Sounds like a lot on their plate. But this sources sought notice shows they're at least thinking about the right things and looking for the right kind of help.
I agree. They're not pretending to know everything. They're looking for expertise and new ideas, even from outside. That's a good sign.
This has been really interesting. I feel like I understand CMS so much better now.
And me too.
To everyone listening, what do you think? What worries you most about healthcare in the future? What advice would you give to CMS?
There's no easy answer, but we can all help make healthcare better by staying informed, asking questions, and talking about these issues.
Well said. Thanks for joining us for this deep dive. Until next time, stay curious.